Before we look at, the cost of care, maybe you can, from where you sit, tell us, given the data and the research that you have undertaken, what is the most prevalent form of cancer within our country? Because we know research is done in Africa and globally, and we have different data. But then, what are we suffering from when it comes to cancer?
Sure. If we look at the prevalence of cancers in Kenya, and this is from the Global Cancer Repository, where we look at data that's supplied by our two cancer registries that are in Nairobi and Eldoret, we see that the top cancers in Kenya are breast cancer, followed closely by cervical cancer, prostate cancer, and then esophageal and colorectal cancers are the top 5 cancers in the country.
Okay.
Of course, we do have underreporting because we don't necessarily have a national cancer registry, but those are part of the ongoing efforts that are being done by the National Cancer Control Program and the cancer registry team to ensure that we're actually able to capture a true sense of what's going on across the country.
Now, talking about capturing the true sense of what is happening on ground. Let's talk about research, because without research we'll not have the requisite data to help us come up with policy as well as also interventions that are tailor-made for the country. What do you think? Have we done enough to ensure that we have localized research that is going to influence treatment of cancers that are prevalent in the country?
I think, Regina, we're just merely skimming the surface. We're looking at some of the data that we did really more on a global level, looking at where do we lie in terms of cancer research. And what we realized is that if we look at a continent, Africa as a continent, we see that we are only, sub-Saharan Africa that is only contributing, cancer research specifically is only 8% of the burden of the bulk of research that's coming out. And then we break it down further, we're saying in sub-Saharan Africa, we're only contributing 14% of that research. Now, sort of driving closer to home, we see that we're definitely having we've done some preliminary data and looking at just over the last 12 years how much research has been generated, and what we've seen is that we've had about 700 publications, which is just really looking at research and dissemination of research. We've seen around 700 papers roughly. What should at least give us a bit more drive is 40% of those have been had a Kenyan author or a researcher. However, only 91 of those papers were prominently, I would say, Kenyan driven, meaning that we are deciding on the research questions and the research topics, but that really speaks to the underlying problem, which is a lack of funding and development in research.
So are you saying it is not enough, that we're not contributing enough, or we are not investing enough as a country towards research that is tailor-made for us when we talk about matters of cancer, Dr. Harry?
Absolutely. I think we're only starting to see an increase. One, I would say, let's acknowledge one, if we look at what's happened over the last 10 years, you would say, if we looked at by 2007, we had about 9 papers on cancer. By 2021, we had over 100 papers a year on cancer, which definitely shows there's an increase. But if we look at the, in terms of the funding or resources available for not just cancer research, but research in general, we see that, I think by 2012, there was a resolution by the African Union countries to devote at least 1% of their GDP towards research and development. And so part of the call from us, from the oncology fraternity, is if we could even just have 10% of that towards cancer research, we would go a long way, because what's happening is, because we do not drive our own agenda, then the agenda is determined by external funders. And so, whoever pays the piper is the one who plays the tune. Exactly.